Bonjour, hello, good day. So it's a real pleasure to welcome everyone to this year's lunch symposium from Nestle on the ISICEM 2025 here in Brussels. It's such a really privilege to stand in front such a distinguished audience of clinicians, healthcare professionals, thought leaders to discuss the topic unmasking the silent gut, classifying gastrointestinal dysfunctions and its impact on the clinical outcomes of our patients. So the topic is really both. It is timely and profoundly important for the daily care of our patients on the ICU. And I'm looking forward to great discussions here. So, in fact, it's really that the gut still belongs to the mostly unforgotten, so-called unforgotten organs, which we are in the daily care of our patients, whereas it is anything but not, whereas it plays anything but a minor role. So the key functions are it regulates the immune functions in our bodies, our patients' bodies. So it's important to regulate the metabolic hemostasis and the microbiome. So both are very important to optimize our patients' antioxidant and anti-inflammatory and immune defense mechanisms. So further, it is known that it has some impact on the outcomes of our patients. So therefore, we really have to care about that. So if we do not care about that and our patients have really severe gastrointestinal dysfunctions, so then we know that it may impact the outcomes of our patients and it impacts the treatment in our patients. So it may prolong the ICU length of stay, lead to complications, and may increase the morbidity and mortality rates. So the pathophysiological underlying mechanisms are something about which I don't want to talk too much, but it's really important to take a deeper dive and to take a closer look into that. When considering the learnings of our recent large-scale multi-center RCTs, we are left with uncertainties about that, because when we consider the trials which have tested early nutritional interventions in our patients, and especially very early aggressive enteral feeding strategies, which have been tested, for example, in the calorie trials or in the Nutria 2 and 3 trial, it has been demonstrated that all of this led to longer time to discharge, more infectious complications, more mortality rates even in these patients that were randomized to a very intense, aggressive feeding strategy. So let's take a closer look into the data and let's discuss this a little bit more. But I just want to bring this to your attention. When considering all available nutrition trials here over the past decades, even for parenteral and enteral nutrition, then it's very important to keep one thing in mind. So most of them, interestingly, were focusing on the very early acute phase. So the intervention really started in all of these on day 2, and most of the nutrition trials demonstrated that the targets were achieved on day 4. So it was a very intense, very aggressive strategy. And nothing really has been tested in these patients when the intervention was started, with a little delay in the post-acute phase, for example. So this is really an area which needs more consideration. But no feeding is as well no option, because we really know that if we do not feed our patients, this is obvious. This leads to significant loss of muscle mass. This really impacts the outcomes of our patients and may increase the infections rate. So these are the really the detrimental, the deleterious effects which we really try to avoid in our patients. So therefore, we have to think about how to enable more careful approaches for our patients, so more personalized approaches in our patients, and to think how, for example, a progressive feeding, which is currently recommended by our guidelines, can be realized in our patients. And we have as well to look like which nutritional strategies exist, what are signs, biological response mechanisms in our patients' bodies. And I'm very much looking forward to have great discussions during our next talks. And it's my great pleasure to invite our first speaker, Professor Vincent from Brussels, to give us the first lecture. Jean-Louis, thank you.